Good morning, student. So, in the last session, we was study about the glaucoma. In short, we will revise it that glaucoma is due to the increased intraocular pressure more than the normal. So, the normal pressure is 16 to 23 mm of Hg. If the intraocular pressure increases than normal, it leads to the glaucoma. It is irreversible condition. Then factors which cause the rise intraocular pressure is the increased volume of intraocular content. Second is the external pressure on the globe. And then we was learn about the classification of glaucoma. In that, first is a congenital. So this is the congenital glaucoma. It is a diagram of congenital glaucoma that which was learned yesterday. Second one is acquired glaucoma. In the acquired, there are two types. A is primary and B is secondary. So in the primary glaucoma, it is occurred due to the without any cause. And secondary is occurred due to the cause is present behind that. In the primary glaucoma, there are also two types, that wide angle or chronic simple glaucoma. And second is a close angle or a congestive glaucoma. So we will study yesterday details that about the congenital or infantile glaucoma, its etiology, signs, symptoms, diagnosis, course, prognosis, and then we will study about the acquired glaucoma. In that we will learn about the primary wide angle glaucoma. It is also called as a chronic simple glaucoma. Then we will learn about the etiology, signs, symptom of primary wide angle glaucoma. Then we was learn about the primary glaucoma, in that close angle glaucoma. Its etiology, its mechanism, sequences, pathology, clinical course, that which contain a prodromal stage, phase of constant instability, acute congestive attack of close angle glaucoma, and this is a diagram of acute congestive glaucoma. In that we will learn about the ciliary congestion, then corneal edema with the mid-dilated pupil. Then there are signs and general symptoms with the termination of acute congestive attack. Then fourth one is a chronic congestive stage. So how the acute stage progressive and it results in a chronic congestive stage of glaucoma. Then fifth is a absolute glaucoma. That is a complete blindness. And the test for a close angle glaucoma, that is a dark room test and mydriatic test. And the last one is a diagnostic criteria and treatment. So the different treatment are different in a acute congestive attack, in congestive stage, in absolute glaucoma. We was learn yesterday in details about all these topics. So from the today, we will learn about the second type of a glaucoma, that is the secondary glaucoma. So secondary glaucoma, glaucoma secondary to some pre-existing disease. That is, there is some disease is exist in a patient which result in a glaucoma. It is called as a secondary glaucoma. Cause of rise intraocular pressure is known, and the intraocular pressure is also raised in such a patient. So when the secondary glaucoma is occur, then it is due to the some pre-existing disease. That is, some disease exists previously in the patient, which result in a secondary glaucoma due to the increased intraocular pressure. So it means glaucoma secondary to some pre-existing or simultaneously occur pathology. While the open angle and angle closure aspect are useful in classifying the primary glaucoma, but they are of less value with regard to the secondary glaucoma. Since Many of these may involve more than one mechanism of outflow obstruction, and depending upon the stage of the disease, the secondary glaucoma is occurred. So, the common type are associated with the lens disorder, in that there is a pseudo exfoliative glaucoma, then pha- pharcomorphic glaucoma, phycolytic glaucoma, pigmentary glaucoma, lens particle glaucoma, neovascular glaucoma, inflammatory secondary type of the glaucoma, traumatic glaucoma, glaucoma with intraocular tumor, steroid induced glaucoma, then glaucoma following the ocular surgery and due to the elevated episcleral venous pressure. And last one is associated with intraocular hemorrhage and epidemic dropsy glaucoma. So, when we study about the secondary glaucoma, the causes are it is occur due to the inflammation. That firstly, due to the inflammation that is acute iridocyclitis, then acute scleritis, corneal ulcer with hypopyon, and panophthalmitis. So, when there is the inflammation in the patient, that is, there is inflammation of the eye, iris, sclera, corneal ulcer, panophthalmitis, it leads to the secondary glaucoma due to the increased intraocular pressure. Then second is the post-inflammation, that is after the inflammation. In that there is a ring synechia, that is obstruction to the drainage of aqueous humor from the posterior to anterior chamber. So there is a problem in the drainage of aqueous humor. So aqueous humor is not drained properly from posterior to anterior chamber. There is the obstruction which results in a post-inflammation secondary glaucoma. Adherent glaucoma after the perforation of corneal ulcer. That is, rise in pressure is due to the shallow anterior chamber. So, when there is a adherent glaucoma after the perforation of corneal ulcer, firstly, the pre-existing disease is that corneal ulcer, which perforate and which perforation leads to the adherent glaucoma. That is, rise in the pressure. In that case, there is intraocular pressure is rise due to the shallow anterior chamber. Anterior chamber is shallow, and there is a corneal ulcer which leads to the perforation due to the and which lead to the adherent glaucoma. So in that case, due to the shallow anterior chamber, there is a rise in the intraocular pressure which leads to the secondary glaucoma after the post-inflammation. Then third is the lens-induced secondary glaucoma. So it is due to the subluxation of lens in the anterior chamber. An intumescent cataract, that is increase in a pressure, is due to the shallow anterior chamber and dislocation of the lens in the vitreous. So, lens induced consists of when there is a subluxation of lens in anterior chamber. So, in the anterior chamber of the eyeball, there is a subluxation of the lens and there is an increased intraocular pressure due to the shallow anterior chamber in the intumescent cataract. So, intumescent cataract is one of the type of the cataract we was learned in the previous lectures. So, which result in there is an increase in intraocular pressure and in the shallow anterior chamber, which lead to the lens-induced secondary glaucoma. Then, lastly, there is a dislocation of the lens in the vitreous. So, when there is a lens is dislocated in vitreous, which lead to the lens-induced secondary glaucoma. So, this is a diagrammatic representation of the lens-induced secondary glaucoma. It is also called as a pharmacomorphic glaucoma. And note in that there is a ciliary congestion and pupils are dilated and intumescent senile cataract. So this is a intimation ciliary cataract. Pupil is dilated and there is a ciliary congestion is seen in a lens induced, that is pharmacomorphic glaucoma. This is the type of the secondary glaucoma. Then fourth one is a hemorrhagic glaucoma. In the hemorrhagic glaucoma, it occurs due to the thrombosis of central vein of the retina. So when we study about the anatomy of the retina, we was learn about the central vein of retina. So when there is a thrombosis, the thrombus formation in the central vein of the retina, which lead to the hemorrhagic glaucoma. And fifth one is a glaucoma due to the intraocular tumor. So when there is a intraocular tumor is present or it form, it lead to the secondary glaucoma. So due to the tumor, there is increased intraocular pressure and it lead to the glaucoma. So there is an irreversible condition of the eye. So tumor causes pressure and it lead to the secondary glaucoma. Fifth one is a post-op aphakic glaucoma. Next is a homeopathic therapeutic of the glaucoma. So there is a treatment. We was learn in a yesterday lecture that the allopathic treatment of the glaucoma, along with the brief description of glaucoma and its types. But in the homeopathy, there is also treatment for the glaucoma, and which is also useful. So homeopathic therapy of the glaucoma consists of the many remedies like aconite napellus or a myrrh, belladonna, bryonia, causticum, citron, cocaine, colchicum, comocladia, crocus sativa, gelsemium, maccarp, nux vomica, opium, osmum santum, phosphorus, physostigma, prunspur, rustox, and spigelia. So these are the very useful remedy we can use homeopathically in the cases of the glaucoma. So we was learn aconite is a great remedy in the eye complaint in that patient objectively seen in the patient that the leads are swollen, red, hard, especially the upper in the morning, edges are sore, inflamed. Then there is a chemosis. The conjunctiva is intensely hyperemic and edematous and mostly toward the inner canthus. Then lacrimation is slight if any. And subjectively the patient feels that the eyes are burned. There is a burning of eyes, feeling of the dryness and which are very sensitive to the air. There is a much aching and heat intense that there is a burning and the shooting pain in the eyeball. Pressure upon the upper lid as if the ball were pushed into the orbit and causing a bluish pain in the eye. So there is a bluish pain in the eye and the pressure on the lid. So in the glaucoma case, when we study that there is an increased intraocular pressure and secondary is due to the pre-existing cause. So in that case, when aconite is useful, that patient feels that there is a pressure in the eyelid as if ball were pushed into the orbit. So he feels that there is a ball and he is pushing the orbit behind the eye and which causing a bluish pain in the eye. Then there is a itching and smarting in the evening. The eyeball, especially the upper half, which is the sensitive if moved, and looking down on turning the eyes. The eyeball feel enlarged as if protruding and making the lid tense. So, in the glaucoma case, when we see the patient feel subjectively that eyeball feel enlarged due to the glaucoma as if protruding that we see in the congenital glaucoma, in the secondary glaucoma, and making the lid tense. So this patient is feel internally subjective, feel as if it would be forced out of the orbit is stupid, and eyes are feel swollen. Feel as if sand were in them, and there is a photophobia. So patient feels subjectively that there is something in the eye that which is a very itching and a very sensation that something in the smarting pain in the eye and feels as if sand in them. So it is a very irritable condition of the eye and vision as the patient see as though have it the difficult to distinguish the faces. So he can't distinguish the faces of other person. There is a spark before the eyes and there is a flickering vision. So this is a characteristic of aconite with the great anxiety, fear, restlessness, thirst is seen in the aconite patient and it is useful in the first stage of the inflammation of trauma of cornea, conjunctiva, sclera and lid. So aconite is always useful in the first stage of the inflammation. So we can think about the aconite in the first stage of inflammation in the all the complaint of the eye. Clinically, this is a routine remedy with the foreign body and wounds operation and for neuralgia from exposure to the cold dry wind. So aconite have an aggravation from the exposure to the cold dry wind. So it is useful remedy when there is a foreign body in the eye, there is a wound, there is a traumatic cataract, then there is a traumatic glaucoma, and there is a pressure in the eye. Then next is the aurum metallicum. So aurum metallicum is also a great useful remedy in case of the glaucoma. It is also called as a metallic gold. It is useful clinically in the glaucoma, in the extreme photophobia when there is a great soreness all about the eyes and into the eyeball. So there is a great soreness, sore feeling in the eye and into the eyeball that patient cannot even touch to the eye and there is eye is very sore to touch. There is a double vision. So patients see other patient in a double vision that one person but he see that there is a two person. That double vision is seen. Upper half of the object is invisible and feel the tense. So upper half when there is a object then he can't see the upper half of the object. So Auromet, the characteristic feature of Auromet is that he can see only the lower half. He can't see the upper half of the object and eyes are feel tense. So there is a bulging of the eyeball, protruding of the eyeball. So it is the useful in the glaucoma. So these are the subjective symptoms of the patient that from that we can study the clinical conditions of the patient and sees a fiery object. Violent pain in the bone around the eye. It is also seen in the asafoetida. So the common feature of auromet and asafoetida is that there is a violent pain in the bone of the. So in the bone of the eyeball there is a violent pain. There is a severe pain, violent pain that patient cannot bear it. And there is also useful in the interstitial keratitis, vascular cornea, pain from without to inward. There is sticking pain in the inward and trachoma with the pannus. So it is also useful in interstitial keratitis, vascular cornea, when there is a trachoma with pannus and when pain from without inward and sticking pain in. So there is a sticking pain, violent pain, and double vision with the glaucoma and upper half of the object is not visible is mostly seen in the aurum mid. Next remedy is the belladonna. So we was learn about the belladonna is a chronic constitutional deep acting medicine and it is also useful in the ophthalmological cases. So objectively, how the patient come and we study how the belladonna is effective in that case. So objectively, the patient shows that there is a pupils are dilated, these are sluggish or immobile dilated. So dilatation of the pupil is mostly seen in the belladonna with eyes are red, lids margin are congested and inflamed. So belladonna is also useful in the inflammation condition when eyes are red, lips lid margin are congested and pupils are dilated sluggishly. So there is a congestion. Congestion inflammation is a key feature of the belladonna. So there is a conjunctiva is also congested, inflamed. The lids group twitch, and lids are puffy, sty, pimples, and pustules. So when we was study about the we was see the patient's eyelid, the groups twitch and are puffy. Eyelid are also puffy and sty. There is a pimples. There is a pustules also present in the patient. With the eyes are dry. There is a no tear. So this is also a marked feature of the belladonna that eyes are dry. Dry eyes and no tear or mucus and tear are increased. Then there is an increased ocular tension. So when we use these remedy for the glaucoma, then we can see in the glaucoma there is an increased intraocular pressure which is seen in this belladonna patient. There is a fundus which is congested. These congested edges are not distinct. Then retina is slightly hazy and eyes are protruding. There is a bright, staring, swollen with a red face and seen a constant motion. So, when we see a belladonna, the eyes are also congested. Congestion, inflammation, redness is a key and marked feature of the belladonna. So, in that cases, when we see all these in the patient, the belladonna is a very useful remedy in such a condition with the eyes protruding, bright, staring. There is a swollen with the redness, red face, eyes red, lid margin congested, conjunctiva, fundus, all are congested, red, inflamed. Then we can use the belladonna in the glaucoma. Next one is a bryonia alba. So we will study in the homeopathic medica about the Bryonia alba. That Bryonia alba is a very useful remedy in the ophthalmological cases where objectively the patient shows there is a puffiness of the right upper lid and there is a morning agglutination and conjunctiva is a dark red and swollen with the lacrimation. So, objectively, patient shows that there is a puffiness of upper and right. So, belladonna is useful in the right sided when there is a right upper lid is puffy, is swollen, and there is a morning agglutination. So, eyes are agglutinated in the morning. That patient cannot open his eyes in the morning, and the conjunctiva is a dark red and swollen with the lacrimation. So, in the belladonna, we see that there is eyes are dry and no tear. But in the belladonna, in the bryonia, there is a lacrimation is present, and subjectively the patient feels that there is a photophobia, pressure pain above the left eye. So, in the left eye, there is a pressure pain just above the left. There is a pressure inward over a left orbit into the brain and which changes to the pressure on the eyeball from the above downward. So pain are deep in the orbit and pressure on the eyeball. So when we see a glaucoma, when there is a pressure in the eyeball, then we can think the bryonia is also useful in the glaucoma condition. There is a drawing and heaviness in the upper lid and very sensitive pressing and intermittent pain in the left ball, especially violent on moving the eyes with a feeling as if the eyes are become smaller and retracted in the orbit with the severe burning and there is a lacrimation in the right eye and eye are very sore and moving. So the Bryonia alba in that case opposite the belladonna that there is the lacrimation is present in Bryonia but in belladonna it is absent. So it is a distinguishing feature of Bryonia and belladonna. Then, subjectively, patient feel that there is a pain, the eyes are protruded, there is a drawing, heaviness, and stitching pain in the upper eyelid. With there is a severe burning in the right eye, and eyes are sore and moving. So there is a very sensitive pressing intermittent pain in the left eyeball. So it is also useful in the such a condition. Then the vision, the how the patient visualize, what the patient sees with his eyes, that is a dim vision, and every object appear covered with the rainbow color. So when the patient see anything in front of his eyes, it is a dim vision. He cannot see anything clearly and feel that there is a rainbow color which are covered to the every object that he sees, and appearance of all the color of the rainbow, and letters are run together or near. So when we see a bryonia, so when we see a bryonia vision, so how the patient sees the object, there is a rainbow around the every object, that he see the all the colors of the rainbow around the object, and the object is a dim, so he cannot visualize clearly that this is object, and all the object is covered with a rainbow color, and letters are run together. So when we reading or anything reading on the front or on the book, and he sees that letters are run together. Letters cannot situated in one place, he run together only. And the characteristics of the bryonia is that there is a motion and heat. The bryonia is a great fear of the use of fullness. It is the diseases of uveal tract in the rheumatic subject and aggravated by motion and by wounds. So when we see the bryonia, it is very much aggravated. The aggravation is the characteristic feature of the bryonia which are seen in the patient. That there is aggravation from the warmth or aggravation from the motion. So patient cannot even touch the hot application over the eye. So there is a very aggravation from the hot or warm when we think about the bryonia alba in such ophthalmological cases, and for the serious inflammation with these aggravations. Clinically, it is the first remedy thought of in the rheumatic arthritis, and with the sharp and shooting pain through the eye into the head, aggravation from the motion, pressure on steady aching in the posterior part of the eye, which is extending through the occiput, nerve and motion. So there is a steady aching pain in the posterior part of the eye and extending through the occiput. So from the posterior part of the eye, the pain are extending to the occiput. So there is aggravation from motion, warmth, night. It is seen in the bryonia alba. It has checked glaucoma and proven a valuable in serious iridochoroiditis and in ciliary neuralgia and episcleritis. So it is useful remedy for the glaucoma. Next one is a causticum. So when we study the causticum in the homeopathic medica, and when we see how the patient come in our clinic, so what is the main key feature of the causticum? That when we use the causticum in these cases, so the patient shows that pupils are dilated and visible with the twitches in the lid and left eyebrow. The eyes are inflamed, lids are red, and lacrimation in the open. So, in such cases, when we use a causticum in the glaucoma, then we will study that the pupils are dilated. There is a visible twitches in the lid and left eyebrow. Eyes are inflamed. So, inflammation, lid redness, lacrimation is also seen in the causticum. And in open air, there is a aggravation subjectively. So, what the patient feel of causticum? That there is a pressure as if sand were in the eye. So, like a aconite, there is a feeling of sand in the eye with the dryness, photophobia, burning, and stinging. With the inflammation, there is a pressing pain in the eye and by the touch. There is a itching, especially in the lid, and disappear on rubbing, and itching in the lower lid and its inner surface, with the burning as soon as he touches or moves the eyes. There is a biting and pressure in the eyes which seem heavy with the redness of the lid. There is an inclination to close the eyes. They close involuntarily and there is a sensation of heaviness in the upper lid as if he could not raise it easily or as if it were stuck to the lower. So when we study subjectively the what the patient feels that there is a pressure as if sand in the eye, there is a dryness, photophobia, burning, stinging, inflammation, but there is a pressive pain in the eye and which is due to the touch. So this is also a main feature like with the itching in the lid disappears on rubbing. So itching is there but which disappear on rubbing. When patient rub the eye, the itching is disappear and itching in the lower lid. So itching in the lower lid and the inner surface with the burning as if touches and move the eyes. And there is a biting and pressure in the eyes and as if heavy with the redness of the lid. There is a sensation of heaviness in the upper lid as if could not raise it easily or as if it were stuck in the lower. So next is the vision. So how the causticum patient's vision that there is a flickering vision like a swarm of insect and there is a photophobia spark on winking. Even on a bright day, vision indistinct, dim as though thick cloud or veil were before the eyes. So there is a dim vision and patient feel of causticum that there is a thick cloud before the eyes. So patient feel that there is a thick cloud before the eyes due to that he can't see anything. And there is a transient obscuration on blowing the nose with the diplopia paretic turning the eyes to the right. And the characteristic of causticum is that while sensitive to cold and cold drink is better in rainy weather. Clinically, this remedy has been credited with curing the wart on the lid and eye. It is useful in the blepharitis in fresh air and simple acute conjunctivitis and in many cases of the cataract have been arrested and even improved. But the main sphere of action is a peripheral paralysis of the muscle that levator palpebrae superioris, orbicularis, external rectus and ciliary muscles and in fact any muscle if due to the exposure to the cold dry wind or if following diphtheria. And causticum is the principal remedy for the glaucoma. So when we think about all these conditions, we learn that how the causticum is useful in the glaucoma with the ptosis and paretic aphonia post-diphtheric and it is not recommended in the syphilitic cases. So when there is a feel the patient that there is a cloud over the eye and patient can't see anything. So there is a dim vision and which is very sensitive to the cold eye, cold weather, cold drink and it is better in the rainy weather then we can think about the causticum in such a cases of the glaucoma. So next is the citron. So citron is also useful and very rare remedy which is also treat by using the citron to the glaucoma. It is also called as a rattlesnake bean. So this is a common name of the citron. There is a shooting over the left eye, glaucoma with the severe pain in the eyeball. There is a radiating pain around the eye with the shooting into the nose. And there is a scalding lacrimation with the supraorbital periodic neuralgia with iritis and choroiditis. So, we will learn about the citron. The common name of the citron is the rattlesnake bean, and there is a shooting over the left eye. There is a glaucoma, severe pain in the eyeball. So, pain is very severe in the eyeball that patient cannot bear it, and there is a radiating pain around the eye. So, around the eye there is a very radiating pain, shooting, severe pain. Patient cannot bear it. There is a scalding lacrimation. So lacrimation is present in the syndrome like a bryonia alba and opposite to the belladonna. And in the supraorbital periodic neuralgia, it is also useful in iritis and choroiditis with the glaucoma. Next one is the cocaine. So cocaine is also useful in the cases of the glaucoma when there is a glaucoma is present with the increased intraocular pressure. So, cocaine is an alkaloid form of the erythroxylone coca. It is useful clinically. Cocaine is very useful as a local anesthetic. So, when clinically